This flu season, as we've heard, is predicted to be the worst in 50 years. And one of the major concerns is dehydration in children. It certainly has serious consequences. And joining us this morning is emergency room pediatrician Dr. Philip Spandorfer and nurse Rekina Hall, whose baby came down with the flu and just couldn't keep any liquids down. We appreciate both of you being with us this morning. And Doctor, I'd like to start with you. More than 30 years ago, my niece almost died from dehydration when she was a baby. Have we not made progress since then?
I'm sorry to hear that. Hopefully she's doing okay.
You bet.
We have made progress, and that's, part of the thing is, dehydration is a major problem in the United States. We see probably about 2 million children a year with dehydration from various causes, and that can be the influenza. Luckily for us in the United States, very few are actually dying from dehydration because we have made progresses in treatment.
All right, so where are we at right now? What is the best way to treat dehydration in babies and small children?
Well, the first thing we're always going to try is, can we give you some fluids by mouth? And so we're going to try to get that child to drink something by mouth. And if the child's refusing or can't keep it down because they keep vomiting, then we have to move on to our other treatments. And what our standard is IV therapy, where we place an IV in the vein and give them fluids. But here we have also a new technique that's an alternative to IV that seems to work as well as IV therapy.
All right, so tell us about that. What is exactly that?
This new technique is actually placing the same IV catheter that we use in the vein, but we actually place it just under the skin. We don't even try to get into a vein. We're just putting it under the skin, and we like to do that in the upper back because it's less painful and it doesn't seem to bother the child as much. We give this enzyme called Hylenex, which helps fluid then be absorbed very quickly, and we just put the fluid right to that catheter, and it gets absorbed into the bloodstream relatively quickly.
And Rekina, your 5-month-old daughter came down with the flu, and obviously you had some very serious issues there. I hope she's doing better. How did you end up treating this?
Well, she couldn't hold down any fluids, not even water. So I started to get concerned. She wasn't having any tears, wet diapers. We went to the emergency room, and me being a nurse, I understand how hard it is to start an IV on someone, especially when they're dehydrated. So the doctor offered alternative therapy. That's how we met Dr. Pip, and he was explaining how the Hylenex goes in the upper back, and it's a one-stick IV therapy. They don't have to try multiple sticks. It's just a one stick, and my baby was actually able to sit in my lap and me hold and comfort her while the IV was being inserted in her back.
Well, that makes it very easy, and we had some shots of her. Boy, she's a beautiful young lady there. Congratulations to you, and I'm glad things worked out. Doctor and Rekina, thank you so much for giving us this new information today.
Thank you.
Our pleasure. Thank you.